We begin with a disturbing rise in the number of COVID-19 cases right here in Michigan. Thank you so much for joining us on this Wednesday afternoon. I'm Alan Campbell.
And I'm Glenda Lewis. Our state is trending in the wrong direction. A big spike today. More than 3,000 new cases were added to the state's total. We haven't seen a number like that in weeks. Thankfully, no new deaths.
Right now, Michigan cases are at a 7-week high and a 50% increase over last week. We have the 10th highest rate of new cases in the U.S.
This is also the third consecutive week hospitalizations are on the rise, up 14% from last week.
The increase in numbers impacting key decisions on COVID restrictions, things like businesses and, of course, Tigers baseball.
7 Action News reporter Jim Kurtzner live outside Grosse Pointe South High School to break it all down for us this afternoon. Hi, Jim.
Glenda and Alan, the numbers are up in K through 12 schools and nursing homes, even with all the vaccinations. State officials are closely watching the variants from the UK and one from South Africa.
And you can see that the number of weekly reported cases to public health is increasing. And we had more than 13,000 cases reported in the last week.
The state's director of epidemiology says Michigan and Minnesota have increases in COVID cases, while our neighboring states are on the decline.
That was a 50% increase from our mid-February low.
State officials say the new variants may be fueling the increase. They've documented 144 of the UK variant, one of the South African variant. Those cases are shaded in yellow.
The take-home message from the slide is that B117 variant is in both peninsulas in the state and has really spread throughout the state. Just a reminder, this variant is more transmissible.
The state shows most new cases are in schools and nursing homes. And get this, the number of new cases in restaurants and bars, social gatherings, and religious services remain low. On Monday, the governor took some heat from Republicans in front of Comerica Park for limiting the number of fans to only 1,000 in an outdoor stadium that seats 41,000. Later in the day, it was hinted that might change before opening day, April the 1st. So we asked today, how was the original 1,000 picked, and how could it be increased? We only got a vague answer from Elizabeth Hertel, the state health director.
And we continue to look at the data that you just had a walkthrough of and work with stakeholders on their processes and procedures to continue to loosen restrictions in a way that we believe is safe.
Dr. Janae Caldoun was also on the Zoom and said, as vaccinations continue to increase, we're not safe or close to herd immunity.
We will not see the type of surge that we saw in 2020, but I still think we are at risk. And again, with these new variants that are more easily transmitted and potentially the vaccine is not as effective, still effective, but potentially not as effective.
Now, state officials talk more in depth about K through 12 schools where the outbreaks are happening the most. What does this mean for the future of in-person classes and state sports? We'll see with that next hour at 6. Reporting live, Jim Kurtzner, 7 Action News.
All right, Jim, thank you. We're going to continue our coverage now with Chief Health Editor Dr. Partha Nandi. And Dr. Nandi, as Jim reported, the new variants may be fueling this spike. What do we need to do to bring those numbers down?
Here's the thing, I think, Glenda, I think people have let their guard down. I think there's pandemic fatigue. Listen, all of us, right? For a year now, we've been doing this and they just want the virus to be gone. Well, the problem is it ain't gone, right? People are thinking that it's just going to go away. So I really think that we have to really continue to do what we're doing until we can get this herd immunity. We're close, right? Michigan's really ramping up immunization, so let's all get immunized. And we're seeing that it's not from restaurants right now. It's coming from high school sports. We're talking about nursing homes. So wherever you go, whether it's in a large setting, whether it's a smaller setting, you have to make sure you watch what you're doing. Mask up, social distance, avoid large crowds, and keep washing your hands. I know we say this, but people are not getting the message. So what I will say is that let's wait a little longer. If you wait a little longer and do the right thing, you're going to make sure that we can all get back to normalcy together instead of having hiccups and slowdowns and shutdowns again. And that's what I think we're headed for if we don't change what we're doing.
And Dr. Nandi, just for clarification, if you do have the vaccine, first dose, second dose, are you immune to getting it, or can you still get it?
You can get it, but it's much less of a chance. What you don't get is extremely sick. So you can be asymptomatic and spread it to others that are not vaccinated, right? We only have, a small percentage of the population that's vaccinated. So you can still get it. You can be asymptomatic and spread it to others. One study showed that you're 94% effective. The Pfizer vaccine is 94% effective in preventing asymptomatic transmission. But there's a bunch of people out there that are not vaccinated. So until those folks are, even if you're vaccinated like me, I still mask up. I still take the precautions when I'm going out there. And that's what we have to not forget to do. No matter how much fatigue you have, how much you're getting sick of this, the virus will not let up if you're not protected.
All right, Dr. Nandy, frightening numbers we're looking at. Thank you for that clarification. Alan.
My pleasure.